All right, welcome back to the brain injury discussion. This is Jay, and we are going to talk about an interesting topic today. Of course, this is coming out around winter, and of course, we're thankful for our pets. And we're going to be talking today about therapy, animals, and brain injuries. So, what a combination that is. The question begs is that, okay, is a pet useful or beneficial to the person with a brain injury? Is this actually good for someone? Well, a article in 2020, and it's titled Influence of Animal Assisted Therapy on Episodic Memory in Patients with Acquired Brain Injuries. It's published in the International Journal of Environmental Research and Public Health. They found that animal assisted therapy can help certain aspects of the brain in recovery, although they have to put the caveat that this was only analyzed in the short term, but they did see benefit in the short term. Now, prolonged periods of time, they did not study, so that is yet to be seen, but that is an interesting idea, saying, okay, there is some sort of short-term potential using animals in therapy. Um, but let's turn to another article. This one was written in 2023, titled Efficacy of Animal Assisted Therapy in Treatment of Patients with Traumatic Brain Injury, a randomized trial. This was published in the Journal of Trauma Nursing, the office journal of the Society of Trauma Nurses, back in 2023, and they found that dog therapy in specific, that there was a noticeable and improved outcome with the group that was engaging in dogs um, over the control group who did not participate in animal therapy. And again, they kind of put the parameters of this is what they studied, this is what they found, and they saw that there was an overall benefit, but the details of which could be explained by the interaction of the animal, but they don't really the details of which are just bland and boring. But they did note that there was some sort of improvement when you added the dog therapy on top of what was already being performed in the therapeutic. Another article written in 2016, it's titled Effectiveness of Animal Assisted Therapy After Brain Injury, a Bridge to Improved Outcomes in CRTs, published in Neurorehabilitation. They note that with animals, it's not only a positive physical effect, or especially on the healing, you might say, of the brain, but it's also good for the mental and emotional health of the individual, and it's more holistic. And when this was published in 2016, they noted that it was holistic, that it was dealing with the whole body, and it ended out with improved outcomes in comparison to, shall we say, the non-animal engaged kind. So, and to stress this is that these articles are so far mentioning the improved outcomes when you add an animal into the therapy, or when you add a dog or a pet into therapy. And we do see those animals from time to time that are strict service dogs. Um, and they will usually have a harness, and sometimes it'll say, "Do not touch. I'm a service dog. I'm on the job." Um, that kind of brings me to my next article that I found on this, and that'll be pertaining to my former field of employment, the military. So let's get into looking at that one. All right. In 2022, this article, A Qualitative Exploration of the Use of Service Dogs in Veterans with Post-Traumatic Stress Disorder and Traumatic Brain Injury, Psychiatric Research and Clinical Practice. Um, they found that service dogs, they're proven effective with a lot of veterans with PTSD and TBI, so post traumatic stress disorder and traumatic brain injuries. They did a series of testing and interviews, and that was their methodology, was testing and interviews. They were probably doing a lot of forms and studying this, and the results showed that in comparison with the control group, that there was overall, mind you, overall, maybe not all the time, but overall, um, improved mental health outcomes and better reintegration into the community, which is quite an astounding achievement. We want everyone to be integrated into the community, and maybe a service dog is what is needed. In terms of those who are not only veterans, but this might also help with others with PTSD, post traumatic stress disorder, or TBI injuries, so traumatic brain injuries. Um, Usually, the reintegration into the community setting, so into your back to normal everyday life, that might be a challenge for some people, and sometimes you might need your best friend along to help you along the way. I can see logically, that does make a lot of sense. Service animals, you do see them, and of course, they're allowed in establishments. And usually they're just like the absolute quietest, most well-behaved animals. I have a friend with a service animal, and they well-behaved dog, just really well-behaved, just calm. Known a few people with service animals, and they say that it really does give them some help, especially with being around other people, especially with the PTSD and the TBI sort of injury scale, where they needed maybe a little bit of support or focus in on something. So that's interesting to think about. Of course, there's more details to these, and of course, the sources will be in the description below, and you can go look them up on your own volition. But there seems to be a recurring theme when I was looking up these sources. These sources were, obviously they're limited in their scope, but they were making the point that at least it is verifiably true in the short term that animals tend to help in the therapy, recovery, and reintegration into the community. So, again, those are kind of the limitations of those studies. They don't really go into far, long term um, results analysis. So, when we're talking about medication therapy, therapeutics, home solutions, there's a ton of that out there for brain injury, and there's still a ton under investigation. And one of the things that I just kind of found myself gravitating towards is that treatments aren't necessarily restricted to hospitals, labs, clinics. Treatment can be at home. Treatment could be what you eat. Treatment could be um, how you eat it or who you eat with. So we're sort of getting into that community integration side of it too. Um, if there's at least some sort of short-term gain from animal therapy, I think it should be more explored, especially when it ties in the mental health with the uh, brain injury or the PTSD. And we might have a tendency to separate the brain or, depression, anxiety, PTSD from the rest of the body, but we also need to think, okay, it's not necessarily about just medications. We also got to think, okay, how are the person going to benefit from this? And this might be more for the practitioners, but patients are not numbers. They are patients. They are people. So again, this might not be good for everybody. And of course, if you want a service dog, there are processes in place. I would definitely talk to a medical doctor about it, especially if they can approve you for one. But there seems to be some efficacy in this, where it definitely is proven in the short term. I don't know about the long term because I couldn't find any studies. But if you do find a study, leave it in the comment below. I'll read through it and I'll give you my read through of it. Um, but at least there are some short term gains when using an animal inside therapy, and when we don't limit treatments to pills, hospitals, and clinics or laboratories, we might be able to find something that you might have at home. And sometimes having man's best friend by your side might be good to have them on your side too. So, anyways, that is this week's episode. I hope you all have a wonderful holiday season. If you have a puppy or a pet in your life, give them a little bit of love. And Best to all of you. If you have a comment, you want to like, subscribe, feel free to do so. And also, if you have a topic or you have an article that you want me to look through, feel free to put it in the comments below. I would love to have your input. But, anyways, have a wonderful one, everybody.